Today, appreciate your commitment to this important cause. As a combat veteran myself, married to a combat veteran, I take very personal stake in all these matters, and thank you for your commitment to the cause. I think to respond to some of my colleagues' comments there, all the more reason why the community care model was introduced and is more critical now than ever, which is the VA has perpetually been under-resourced, especially in rural states like Montana, where you cannot have a VA clinic in every town. And when most towns are 2 to 3 hours apart, when it's a 5-hour drive from Plentywood to Helena, the expectation that a VA clinic will be available within reasonable driving distance in a negative 30-degree snowstorm is unlikely. And taking advantage of the community care options and investing in community care, especially in our rural states, is just as important now more than ever. You made a great point today, Dr. Fletcher, that I want to reinforce, and that's the alternative care model, that we're seeing so many veterans now flying to Mexico, flying to the Middle East, going to Turkey to get psychedelic treatment, that they're finding immediate relief from PTSD, from TBI. They're finding it to be safer, healthier, and far more effective for them and their families. And yet that type of treatment is not only not provided by the VA or our healthcare system at all, it's been stigmatized and in some cases treated as illegal, even though it's working far better. And I think whether it's acupuncture or dry needling or yoga, meditation, sleep therapy, or alternative psychedelics, we need to be open-minded about how we can adopt these therapies. And unfortunately, this isn't a knock on the VA, but the government is not inherently going to be an innovative, entrepreneurial, creative place. It's just not. It's opposed to the DNA of a government bureaucracy, and we shouldn't fight that. We should welcome that and say outside groups like Wounded Warrior Project, like other nonprofit organizations, can be those hotbeds of innovation, and we should be able to welcome those in and welcome their creative thought process. Because at the end of the day, it's about the outcomes, not the process. Veterans not victims, patients not bureaucracy, and outcomes over process. And at the end of the day, that's what we have to focus on. So thanks for your comments there. Ms. Hunter, I want to go back to a comment you made. I think it was incredibly relevant. I'd like your thoughts on that. You said, no matter what the legislation or the policies are, if they're not executed properly, none of that matters. And I think that is government in a nutshell at the end of the day. We can all pass laws, but if the people that we employ to enact those policies aren't the right ones or not doing it properly, it's going to fail. This written informed consent law we're trying to pass, I think, has broad support across the veteran, the nonprofit, and the healthcare industries and communities. I'd like your thought on how, should this pass, how we ensure that when it passes, if it passes, we enact it properly and the outcome is what we want.
Yeah, I think informed consent is important because it's an explicit way to ensure the patient knows about the risks of the medications they may be taking. In the case of the Opioid Safety Initiative, we did find that the informed consent was lacking and recommended that VA take steps in implementing our recommendation. They implemented a tool, so in the medical record, there's a flag to show whether or not, my understanding is to show whether or not that informed consent for long-term opioid therapy was discussed and signed by the patient. So I would suggest perhaps a similar approach where in that medical record, if it is expanded to other psychiatric or other medications for informed consent, there could be a similar flag that in prescribing it, it blips up on the medical record and they can then have that discussion with the patient, including the date that was had.
Do you feel the VA is currently structured to be able to effectively implement this rule? Should we pass it?
I will acknowledge it's been a while since we looked at this, but I do understand that what I understood is that tool was in place in their medical records. Now I will acknowledge a lot is happening with the medical records right now in the transition, but should what we understood to take place when they implemented our recommendation in 2020 still be there, still be utilized, I think it's worth asking. I think my understanding is it could be a simple process to add that and that providers would be continuing to do that. I've not heard any cases where it has been lacking, but again, it's up to each provider in that medical record to document that for that individual veteran.
Now, on its face, unrelated, but all things relate to this. Do you think this is yet another reason why we must re-emphasize electronic health records, linking DoD health records that have a seamless pass-through to VA health records so we do not have to continue to waste billions of dollars and years and lives losing medical records from years in service, from combat injuries that have been meticulously documented by the DoD, and then we throw them in the trash and rebuild them from scratch for the VA, which takes years, missing treatments, missing symptoms, and failing our veterans? Is it finally time for us to have a DoD to the VA health record that is seamless and there's no delay and there's no ledge that people fall off of?
Absolutely.
Thank you.